All right. Well, you just tell me when to go.
Go.
Go. All right. So the next test is for the glenoid labrum. If you remember that, that's a lip of cartilage of the glenoid, and the humeral head sits in it, and so that lip of cartilage can sometimes be torn. And that long head of the biceps tendon attaches to the labrum. So sometimes a biceps tear can tear the labrum, both of them. So here, why don't I have you lay on your back, your head down this way. And I'll just demonstrate from this side. I think you'll be able to see it. But arm is, abducted to maybe about 120 degrees. And I'm going to kind of capture her hand just in my armpit. I am right here, right? And I'm going to grab her proximal brachium, and I'm going to put a load into her, towards her spine, towards her chest. So I'm axially loading, and then from there I'm going to do a clockwise rotation, and after that I'll do a counterclockwise rotation, and I'm really looking for a clunk. She does not have a clunk. And that can indicate that that labrum is, as we're rotating it, we're kind of catching that little lip of cartilage. You get a cartilaginous, crunchy, clunky, gross noise. You're good. All right, I'll sit you up here. And then you can face this way. So the next one is O'Brien's test. So here, we're going to have the arm in this position, and we're going to go in about 10 degrees, and we're going to fully internally rotate. So here I'm going to push down and see if the patient is in pain. If she is in pain, we're going to see if by fully supinating her arm and doing the same maneuver, if she is pain-free. If that's the case, that's indicative also of a labral tear. Pain in that position and then relief of pain in this position. And that was the O'Brien's test. A couple other ones for shoulder capsule and ligament instability. One is the load and shift. So here, Rachel, why don't I have you sit down here facing this way? So load and shift, I'm just going to be finding her humerus right there. And so if her humerus is this size and her glenoid is here, I'm going to be looking for it to move maybe about a 1/4 of the size of that humeral head. That would be normal motion going either direction. If it's moving about half that distance or 3/4 that distance, it's showing that that area is really sloppy. So I'm going to compress her scapula. I'm going to grab that humeral head. I'm going to push in, and then I'm just pushing forward and backwards. And she, has maybe less than a 1/4 of that distance movement. It's definitely a very stable shoulder joint. So if she had a lot of motion, that might indicate, glenohumeral instability is a factor in her shoulder pain, but she does not have that, all right? Another test that we can do is the apprehension test. So you can do it sitting, where we're getting her in this position, and we are externally rotating, and I'm looking for signs of apprehension. She would be unimpressed with me putting her in this position, all right? I prefer one where she's laying back. Can I lay back here? Comfy. Do you want to scoot this way? Great. This one's a little bit more protected and controlled. So here I can bend her elbow, and then here I can also put my hand underneath her shoulder, and then I can just simply externally rotate. And if she's dislocated her shoulder, has a really loose, sloppy shoulder capsule, she would be looking apprehensive. There we go. So that's a position where she would, she might end up needing some serious rehab or potentially tightening surgically of those ligaments.